That is the cutest thing I've ever seen.
On this episode of Bondi Vet,
Oh, it's like having a baby again. Oops!
Alison embarks on a mission to save a vulnerable Aussie icon.
I think I've got this knowledge bank now to be able to help koalas in future.
Everything from the shoulder joint down isn't how it should be.
Chris faces a dilemma over how to treat a puppy with a tragic deformity.
To give her the best possible life. There is only one answer.
Hello, pussycats. All I can see is wall-to-wall cats.
And Scott helps a cat lover with a heart as big as her house full of felines.
Hello, beautiful. Well, I think I can see the problem straight away.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
In Brisbane, mobile vet Alison is treating herself to a day with some cuddly Aussie favourites.
Today I'm off to Lone Pine Koala Sanctuary. I'm really excited for this one because I get to learn a lot about iconic Australian wildlife.
But today is more than just a fun day out. Alison is on a mission that's very close to her and her twin sister Audrey's heart.
During the 2019 bushfires, Audrey and I were really involved treating the injured wildlife. And we ended up treating quite a lot of kangaroos. So I'm really interested to see the other Australian wildlife that were affected by the bushfires and in future be able to treat more than just kangaroos.
Lone Pine is the world's largest koala sanctuary. Alison will spend the day learning all about these vulnerable marsupials from resident vet Galit.
Hi, how are you?
Good, lovely to meet you. Welcome to Lone Pine.
Thank you, I'm very excited.
Yeah, looking forward to spending the day with you, and we're going to go through a whole lot of stuff about treating koalas.
Perfect, let's get started.
Okay.
How many koalas here at the moment?
There's 100.
Wow, busy day.
Busy day.
Galit is really passionate about all wildlife, especially koalas. She's been around the sanctuary caring for each and every koala for the last 28 years. She knows every koala by name, their distinguishing features, whose mum was whose grandmother was who. It's not just a job for her, it's a family.
Well, we're going into our retirement enclosure, which is where all our aged koalas are.
Galit starts Audrey off gently with Lone Pine's old timers.
Hey, darling. So this is Minty, who's very impatiently waiting for her place because she really likes it. So what this is a Criticare formula for koalas. Because Minty's really aged and her teeth are just really worn, which is the limiting factor for koalas.
So how old is she?
So she's 12.
I love how she holds her hand when you do it. Worst case scenario, they don't take the pace, you know, they're not getting any of that important nutrition in there, their gut's not moving. What does that mean for the koala?
If the gut stops moving,
That's lethal.
then they pass away because they just don't function anymore. Want to give it a go?
Alison begins her hands-on koala education by giving thirsty Minty some water.
Oh, you are a good girl. Good. Yeah, she is such a sweetheart. We're all very attached to Minty.
So friendly as well.
You had enough, hey? You had enough and now she just looks for leaf. She's happily eating in the tree, so we might go and talk to another koala down here called Rusa.
Bye, Minty.
See you in a minute,
Enjoy
Minty.
your leaf.
So this is Rusa. Rusa's not quite as engaging as Minty. There's a little piece of swamp mahogany, she might like that. So she'll like
good stuff.
The red tippy bit, so if you offer that to her, so just offer her, and she'll go, oh, when did that get here? So when a koala grabs at a leaf, they'll grab at the base.
Oh yeah.
So there's a real technique to hand feeding a koala. You don't just kind of offer them this bit. She gradually moves it in with her tongue. She manipulates it with her tongue and then grinds it with her molars. So
that must be so rewarding to actually see her eat and chew with those teeth.
Yeah, no, it really is.
So who knew that koalas are extremely fussy with what they eat? The best leaves are at the very tips. They're the new leaves or the baby leaves, and they're actually quite a lot softer. The creme de la creme of what koalas love to eat.
So we have a koala in here called Esmeralda, who has a joey called Belle.
Esmeralda and Belle.
Yeah.
Gorgeous names.
Yeah.
From the retirement village to the nursery,
That is the cutest thing I've ever seen.
Alison's next lesson is with cuddly cuties at the other end of the age spectrum.
All right, it's okay. It's all right, I've got you. Hello, darling. I'm just going to borrow your baby for a minute. I've got you, and I'm going to wrap you up so you're not worried.
Bella's off for her fortnightly weigh-in to check if the little Joey is growing normally.
Hey, little girl. 1027.
So is that a good weight for her?
That is.
Oh,
yeah,
good.
it is. Yeah, she's over 1 kilo already.
Nice and healthy, baby
Hey, big girl. I'll give her to you.
Oh, yes, please.
Just hold her quite firmly so she feels really secure. There we go.
It's like having a baby again.
Watch
Oops.
those claws.
So holding this little swaddled Joey is just the most heavenly thing. It's just gorgeous. It's tiny. It's absolutely tiny. And it just is that whole mummy protective thing that comes out. Okay, so I just hand her up.
Just put the towel up and then let the baby kind of crawl out. There we go. All over for another fortnight.
The neonatal session continues with Alison, and she's in for a tiny surprise when she meets Tabby and her 6-month-old baby.
There's the baby's mouth.
Oh, wow, yeah. Oh, baby.
Oh, Tabby, you are so tolerant. No, you don't like the taste.
So Tabby is a first-time mum, and Galit is a little bit concerned because the Joey has had a bit of diarrhea. So she's been giving the Joey some antibiotics, and trying to manipulate that Joey to give it oral antibiotics is a little bit tricky. Is this one a little girl?
There we go.
Oh,
Hello.
Hello.
If she's coming out.
What we did witness is the Joey coming out of pouch for the first time. But she's tiny, isn't she? Actually clawing its way up all over Tabby's face. It's the first time I've ever seen a Joey come out of pouch. Just a very, very special and touching moment. Look at her face, she's like, and this is #MumLife.
Yeah, right? That really is.
Oh gosh.
Yeah, no, this is what they do. They wear them as a hat.
Oh my God, I don't think I've ever seen anything like that.
Get off your mother's head. So she'll be probably looking for the pouch and nuzzling, because she doesn't know. She's not been out before. She doesn't know where it is. Koalas are really interesting animals to work with. They're quirky and endearing, and getting to know them on an individual level, right from Joeys through to old age, and experiencing their whole lifespan, for me is really special. Okay, so we're going to meet a koala called Major.
Okay.
He's an adult male. He's very, very sweet.
For the final lesson of the day, Galit's asked Alison to conduct a full health check on 8-year-old Major.
So if you want to have a listen to his heart,
Yes, please.
it's in the pretty standard position that most mammals are in. So normal heart rate would probably be about 80.
Not too different from a dog or cat.
Yeah.
The koala class is coming to an end, but Alison's passion for helping injured wildlife looks set to last a lifetime.
You see he's already putting his foot out.
Oh, he gets right in there.
There you go. Oh, you're a good boy. Alison's been awesome. You know, it's lovely just to have someone who's really interested and wanting to learn more and know more. Koalas are so specific in their needs. Really, it would be very difficult for a vet who'd never seen a koala before to know what to do when they're presented with one that needs veterinary care urgently.
Well, thank you, Galit, so much for having me. It's been the best day. I've really enjoyed myself. I feel like I've learnt a lot.
Good.
So I've been really inspired here at Lone Pine Koala Sanctuary today. I've learnt so much from Galit. I feel like I can take away this information and use it productively in my wildlife work, and definitely be more prepared for the next bushfires. I think I've got this knowledge bank now to be able to help koalas in future.
Hey, baby. There you go. Is that comfy?
At the Bondi Clinic, Rose has brought in 11-week-old Annika, desperate for Chris's help for the little girl's deformed leg.
You're going to be very brave.
The poor Akita puppy has had a rough start to life, and was recently surrendered to the Animal Welfare League.
Oh, thank you. Oh, thank you. Oh, thank you. When I first saw Annika, I saw that leg and was kind of a little bit overwhelmed. I really hope that it's not causing her any pain. That's the main thing that I'm concerned about, really her quality of life. And I'm really hoping that Dr. Chris can get to the bottom of it.
Hey there. How are
G'day,
you?
Chris. Rose.
Nice to meet you, Rose. This is Annika.
Yeah, this is Annika.
And what about you?
Yep.
Wow, look at that.
Yeah.
All right, let's see if I can help you.
Yeah, okay.
Come on in.
Thanks very much. Come on.
No matter how much it feels like you've seen animals with all sorts of different problems, there's still that moment when I first lay eyes on Annika where I think, wow, what is going on with that leg? Yeah, that's like nothing I've ever seen before.
Yeah, me too.
Do you know much about how she came to be this way?
She was apparently born like this,
Yep.
and the owners who bred her just brought her in and couldn't afford any treatment.
Well, as far as you know, there's no history of any deformities or any other problems.
We think that she was part of a litter and the rest of the litter died, and the mum was in labour for about 3 days.
Okay, so it's obviously a pretty tough start to life for any dog, and I mean she's clearly lucky to be here if all the rest of them didn't make it.
Yeah, definitely. She's pretty special.
This sort of situation is certainly a first for me. I've never really seen a case like it, and there's a lot of wondering just how I'm going to be able to help her. And I guess if there's one thing that's probably a little bit sobering is that obviously the leg is the most obvious issue that Annika has, but to be born into a litter where none of the other puppies have survived,
Yep.
the concern is she may actually have other issues there as well.
Oh, I really hope not.
Obviously with that twisted leg being such a dominant feature, the temptation is to rush in there and just look at that. But there's every chance that what we're looking at here is a genetic abnormality, a deformity. So if you have one issue, quite often you have a second one, and that is certainly a worry.
Good girl.
One of those areas where you often do see a lot of problems in dogs that genetically aren't quite right is in the cleft palate, so just in the roof of their mouth.
Yep.
It's important in such a sad case like Annika to try to find some positives, and already we do have some because her eyes, her ears and her mouth are actually looking pretty good. All right, so let's just have a listen to her chest and just see what's happening internally. All right, so look, the heart actually sounds pretty good.
Oh, good. Great.
Yeah, I mean, the beats are quite clear. They're quite strong, and her lung sounds are also very clear.
It's a relief for carer Rose to hear that so far Annika is looking good. So Chris can now turn his attention to the front legs.
So I can feel her scapula, the shoulder blade there. Hello, thank you, it's very kind. Yeah, bit of encouragement, thank you. And we go down to a humerus there. All right, so we're feeling pretty good. Nice, free and easy.
Good.
Which is very important because at the moment this front left leg is doing a lot of work. It's really supporting that whole front half of her body.
Good. Yay.
All right, let's look at this leg.
Okay.
Starting at the top, there is a shoulder blade there. So that part feels like it's formed relatively normally. As I work my way down across her shoulder blade and then onto her humerus, everything's feeling pretty normal. But suddenly, once I reach Annika's elbow, things take a dramatic turn. We're really 90 degrees off where we need to be, which is a long way.
Yeah.
Everything from the shoulder joint down isn't how it should be.
Okay.
We get to there, and that's kind of where we stop. One of the front leg's main jobs is to be able to reach forward and allow a step to take place. But in the case of this leg, the range of motion just isn't good enough. So with those toes pointing so far back, they're never going to support the weight in the position they're in.
Right.
And there's no clear definition of her individual toes.
Yeah, right.
So we know she's got feeling in the upper part of the leg because she doesn't like it when I push it forward.
Right.
But I'm very keen to see if she's got feeling in her toes,
Okay.
because that'll tell us whether we have a nerve running all the way down to the bottom of this leg.
Oh, right.
I'm squeezing really hard there. There's nothing there, is there?
Yep, she's not responding.
Suddenly, we arrive at what might be the most dramatic finding yet. Annika has no feeling in that paw. If she can't feel in that leg, it really limits what we can do with it. And obviously I'm, at the moment, just trying to think of every single possibility we can come to and arrive at to give her the best possible life, because that's what it's all about with her. She's a puppy. She should be tearing around playing. She should be having the time of her life. But for her, short little bursts are even too much.
Annika's a gorgeous puppy. Just the thought of her being in pain or being exhausted means her quality of life is compromised, and I can't watch a dog going through that. There's just nothing more heartbreaking, and I'm choking up just at the thought of it because it's really, really sad.
So, yeah, I mean, it's kind of, I guess, the living proof of why she does need something to be done.
Yeah, that's really heartbreaking. I just want her to be okay.
Yeah. What I'll do, could I get you to stand just here with her? And then I'm going to stand up this end. And hopefully when I call her, she'll come running towards me, because I want to see how those legs of hers move.
All right, you can do it.
Rose has brought Annika to me in the hope of me providing her with a good quality of life, a positive outlook. But I can't do that unless I know exactly how she's walking right now. Annika, come on, come here, come here, come here. Good effort. Watching dogs with 3 functional legs walk is always an amazing thing to see. But in Annika's case, she does something that's quite surprising. So, it's obviously not easy for her. Each of those steps is an effort, but she is still in the learning stage.
Yep.
Can we do it one more time?
Sure.
Because there's something that I noticed there that I want to look at more closely.
Come on, baby.
I keep on reminding myself of the fact that Annika's 7 kilos now. She could be 40 kilos one day.
Go to place.
Come here.
Go to place.
And the way she walks right now, I don't believe is sustainable. And if you look closely, at the same time that this leg goes forward, this leg here, in trying to do what it wants to do and actually walk, actually pulls back.
Right.
When it does that, it does something to the way she walks. It actually throws her off balance.
Poor thing, that must be hard.
Yeah. When walking on 3 legs is hard enough, having this leg do that to her is an even bigger issue for her.
It's going to be impossible.
It's going to make it really hard. The best thing now is to take an x-ray.
Okay.
Now, an x-ray is going to tell us exactly what's happening structurally with this leg.
Righto.
We now know more about what's happening functionally, but once we know what's happening internally with the bones, then we then have all the information we need to make a judgment call on what we can do for that leg.
Okay.
Every single step here is revealing more and more about how Annika lives her life. But if she's going to live a happy life long term, we need a solution. And that solution ultimately revolves around what's happening on the inside of this leg. So are you okay if I take her through for an x-ray now?
Yeah, for sure.
And then I'll let you know exactly what we find.
Yeah, baby, be brave. You be brave. Let's go.
All right, thank you.
Thank you.
I'll see you soon.
Bye. See you, honey.
It's all right. Come on, sweetheart.
It's okay. It's okay. There we go. Yep.
X-ray.
Can't say I've ever seen an x-ray like this before. This forearm here, which is, you know, the equivalent of this on me, that should be about twice the length. And it's just not really going to its full distance. And these toes here, it's just essentially a little bag of bones. And looking at this x-ray, it really confirms that what we're looking at here is a deformity. There are a lot of different ways to interpret this result here. For me, it is a good thing. What we're seeing here is confirmation of what we've been essentially proving over the last few hours. So to me now, it's clear how we provide Annika with a bright future, how we can actually give her the rest of her life pain-free and full of happiness. There is only one answer. Hey, Rose. All right. So, to me, the easiest way to open up a future is quite simply to get rid of that leg.
Okay. Fair enough. Yeah. Yeah, I guess if that's what you think is going to be the right thing, that's all I want.
Yeah. There's no way of saving the leg. I think that's the thing to remember here. There's no way of putting sensation into a leg that has none.
Yeah.
There's no way of rebuilding a leg when the bones actually aren't there in the first place.
Fair enough.
And so that's where the challenge is, and the positive outlook here is the fact that she'll do brilliantly without this leg holding her back.
Yeah, it's really kind of overwhelming at the moment, but I know that this is the right thing, and I've just got to stay strong for her.
Right.
Okay,
I'll
thank
see you
you so
soon.
much. Thank you.
No worries.
Thank you very much. Bye, Annie. You'll be a good girl.
See you soon.
Thank you.
How you feeling? You ready for this? It's going to be a good thing for you. Yeah? You're going to be fine. My whole mission here is to really make sure that Annika's quality of life is improved and set her up what should be a happy future ahead. But that future won't be happy unless she can walk well.
All right, let's get started.
Vet nurse Liesl is assisting Chris with the difficult operation.
The challenge at the moment is really working my way down through the skin, through the muscle layers, past the blood vessels to where I need to actually go through the leg. Just getting to a collection of nerves and blood vessels here. They're only small, but they can still bleed, so we're just going to clamp those off before we cut them. How's she doing?
She's been stable the whole way through.
Okay.
Once Chris is safely through the layers of muscle, he can begin delicately severing the nerves in the top of the leg.
Normally when you cut through nerves like I'm doing now, you get a twitching down the leg. But as I'm cutting through these, nothing's actually happening. So it is further confirmation that for whatever reason, the nerve function to the bottom part of this leg just is non-existent. Okay, Annika. There we go.
Finally, the deformed leg is removed.
It's actually come off reasonably well. I mean, we've managed to preserve all those blood vessels. Those nerves, we've cut through those with no major problems. So now comes the next challenge. It's sewing all together. Okay, we are done. We're looking pretty good. It's like there was no leg there at all. Annika's come through that operation remarkably well. When you consider how young she is and still how small she is, losing a significant part of your body like that, it is going to take its toll. From here, she just has to rest overnight, and tomorrow morning we'll start to see the future Annika, the new Annika, and hopefully the happy Annika. There you go. You through the hardest part. You just need to have a good sleep now. Yeah. Yes. Hello again. Look at you, huh?
It's been just one day since Chris removed little Annika's badly deformed front leg.
You bounced back, haven't you?
The 11-week-old rescue pup is recovering remarkably well and is already wreaking havoc.
This just says it all, doesn't it? This? Yeah? And this, right? Yeah, it's been quite the night. Annika recovered quite quickly to the point where she was licking her suture line and then decided to chew her own drip out, which is why she's now wearing the cone of shame.
Good girl.
There we go. We get to see now, don't we? Yeah? Look in the eyes and say, why did you do it? Because you can get away with it, that's why you did it. All right, let's have a look at this wound. She's looking pretty good. We're not overly sore either, which is nice. I mean, it's going to be sensitive. So far, so good. I mean, she's bounced back remarkably well, and importantly, the area where we took the leg off looks healthy. All right, good progress. Although you and your tongue already knew that, didn't they? Every indication from Annika this morning is she's ready to go, but we need to see how this body performs. Annika, come here. Annika, come here. Come here, come here. Come here, come here. Oh, yes. Look at you go. This is the first time I've seen Annika run. Call her again.
Annika, come here, Papa. Come here, sweetie. Oh, you're so good.
You look at her face and it is full of delight. Suddenly, there's now so much to be excited about for Annika. And I know Rose is going to be desperate to see this. You ready for your moment? Yeah? Let's do it. Hey, Rose.
Yes.
Come out here.
Okay. Oh, baby. Oh, look at you. I missed you.
Look at this.
Wow, I know. I haven't seen that tail move for a while. Seeing her run, there's just no words. My heart's just bursting. I was expecting to see her, look like she was in some kind of pain, but true Annika form, she's fantastic. She's such a trooper.
So she's in pretty good shape.
Yeah.
And the wound looks good. It'll certainly flatten out and really improve it.
Righto.
All right, well, there's only one thing left to do.
Thank you so much.
And we're over to you.
Okay.
All right. All the best.
Thank you so much.
Very special to her.
Thank you. Thank you for everything.
No problem.
That's unreal. All right.
All right.
We'll keep you posted.
Please do.
Thank you.
I feel like I've got to know Annika so well, so quickly. And it's sad to see her go, but that sadness is really mixed with optimism because that personality of hers will go a long way with the right family. And I'm sure she'll find it.
Let's go find you a home, huh? Good girl. Let's go.
Hi, I'm Dr Danny Dusek. If you love our show and want to see more amazing stories from the Bondi Vet team, just hit the subscribe button. Click that little notification bell and we'll see you for our next video.
There's a good girl. You don't want to go out today, do you? Because it's very wet and raining. You've got your best shoes on, haven't you? Said you're mad, you are, Mummy.
South of London in Sussex, animal rescuer Liz is hoping Scott can help one of her favourite cats, 3-year-old Josephina.
She says, and exactly why am I seeing Uncle Scott today? Well, he's going to have a little look to see if he can do something about your little eye. No more sore eye,
Josephina is one of hundreds of cats being looked after at Liz's sanctuary. But this orphan was rescued from abroad.
We were doing a sterilisation project for the street cats in Spain. And when I first saw her, she was in a little, oh, I get all funny now. She was in a little garden full of cactus plants and she really sort of struck a chord because she just looked so vulnerable. Her ears were all crusty with sun damage and her eye just looked sort of horribly infected and messy and it looked painful. And I knew if we put her back after spaying and neutering, she would not survive. I knew she wouldn't make it. So she ended up coming back. With so many here, they're all favourites, really, but some you do get closer to, and Josephina's one of those. Oh, that was very naughty, wasn't it? He's just sitting quietly, aren't you, Private Ryan, minding his own business? Dear me. Although she seems quite petite and a little lady, she's not averse to sort of giving a little left hook if she needs to, just to establish her place in the hierarchy. We don't want you to become a real spoilt brat, do we now? Be a spoilt princess, but not a spoilt brat. Terrible behaviour. I kind of say sort of soppy things to her, like she's Mummy's little princess, which I know if you're doing rescue, you're supposed to be all kind of matter of fact about everything. But she is such a little sweetie. There's a good girl. Good girl.
Since bringing her back to the UK, Liz has been treating Josephina's troublesome eye with antibiotics. But recently the condition has flared up again.
The eye is very sort of weepy at times. I think from talking to Scott a little bit about her that it could easily be prone to infection. I don't want that to happen.
Scott's looked after many of Liz's cats and has promised to drop by tomorrow to examine Josephina.
She is a very special girl to me. I try not to let emotions cloud what needs doing, but I have got lots of confidence in Scott, so I think it would be really good to go ahead and see what he could do to make things just perfect for her.
works. Hello, pussycats. Hello, none of you are Josephina, are you? As I walk in the door, all I can see is wall-to-wall cats. It's really terrible weather outside today and they've all come on in. So there's even more in here than normal. It's an incredible sight to see. Hello, beautiful. Well, I think I can see the problem straight away. It's a little obvious, isn't it?
Well, with her little eye, it looks quite sort of weepy.
Yeah.
And looking really sore.
All right, well, I can certainly see a little bit of discharge around that eye, but I do want to have a closer look. So why don't we just pop her on here?
Yeah. Oh, dear.
Oh,
there we
dear.
go. Oh.
You are a feisty little madam, aren't you? Yes.
There, you stay there. No.
Hey, is she a special cat to you, is she?
Yes, she is quite a spoilt little princess.
I see.
Her, yeah.
I see. The spoiled princess of the boss. I can see why she's got delusions of grandeur. Hey.
She's actually been a little bit naughty and petulant. She's almost bordering from being a spoilt princess to being a spoilt brat, just slightly.
There just is nothing there. All right. All right. All right. Okay. Okay. And how long have you had her for?
Probably almost 2 years, about a year and a half.
Okay, and it's been like this the whole time?
It has, yeah. Although when I first got her, it was a mess. It was horrible.
My guess is that this is actually a developmental issue, and I don't think that her eye is properly formed in the womb.
Oh, right.
And as a result, there's a whole... And she's off.
Yeah.
She's got a cavity in her head that's filling with bacteria. And it's very red and there's a bit of infection present because it's literally just like a little saucer just waiting to catch whatever's in the air. And that's why she's got this sort of chronic and ongoing discharge.
Yeah.
You do see a lot of cats with just one eye, but normally it's because they've had surgery to remove the eye and all the support structures, and then it's closed. In Josephina's case, it is literally just an open cavity waiting to be filled with dust and bacteria. That's going to cause chronic and ongoing infections and inflammation, and definitely will be upsetting Josephina. So what I think is the best way forward is that we have Josephina come up to the practice in Richmond and we perform surgery, which is to knock her out under anaesthetic and then remove all the support structures there, remove whatever's left of the eye and then close it up so it's not that ongoing source of irritation that it is at the moment.
No, that sounds a good plan of action.
You look worried though.
I am a little bit. I mean, I'm quite confident, but I'm just quite close to her.
Yeah, she's your little shadow by the looks of it.
Yeah, she is a little bit, yeah. She seems to really like me, which is quite nice.
Liz will bring Josephina into the Richmond practice tomorrow for the operation.
I feel happy that she won't just get vet care, she'll get extra love and cuddles as well. So I know it's in her best interests.
We'll get through this together, won't we, sweetheart?
She likes you now.
I don't know. When she works out what I'm going to do to her, that might all change. Hey, sweetie. Hey? Good girl. Yes. Hi, Liz.
Hello.
Hi, Josephina. Hi.
It's a big day for Liz and the feisty 3-year-old Josephina. After battling a chronic eye condition all her life, today may be the turning point.
Scott's going to be doing some surgery on Josephina today on her eye, or rather lack of eye, which I hope is going to make her a lot more comfortable.
Well, I think it's the right decision. I really feel that without that abnormal eye and socket, it's going to make a big difference to her quality of life. Say goodbye to Mummy.
Okay, good girl, Mummy loves you. Oh.
When you see her again, she's going to look
yes, you're
quite
going
different.
to look even prettier, aren't you? Okay. I'm going to be thinking about her a lot today, but I know she's in very good hands, so I'm just going to go and have a big cup of coffee and look forward to collecting her later.
Hey, Nath. Oh, hey, Scott. This is Josephina. She has got a very unattractive eye, which is causing her a little bit of grief. Come here, baby. Come here, beautiful. So she's got one very beautiful blue eye and then one really quite awful one. You can see it's just not developed. And that cavity just fills with muck and it's all inflamed and infected. So I think it's a situation of better out than in.
Yeah.
Good girl. Josephina is a patient. She is quite feisty. Do She's very happy to use all of her weapons, and she definitely is using the back leg talons on poor Nathan. Cheers. Oh, wowza, Nathan. The battle scars are working with cats, eh? It is absolutely inevitable that we will have scars as a result of our job, but they're just a little bit fearful. Everyone is when they go through an anaesthetic or go into a doctor's office, and the same applies when an animal comes into a vet, but it doesn't mean it doesn't hurt. Okay, let's have a little look at this eye, shall we? It's great when you have an animal under anaesthetic because you can really look at what you're dealing with very closely. There is a tiny, very abnormal eye right at the back of the socket, and all the tissues around the outside of the eye are very inflamed, and there's a huge amount of goop and muck in there. So clearly she's getting infection as a result of the eye, and that's why I think it's best that it all comes out. First of all, I'm just going to close the cavity, and then I'm going to incise around that, removing all of the support structures around the outside of the eye. Then getting to the back of the eye, I'm going to then cut the blood vessel and the nerve supplying the eye, and then remove the whole lot. Although this is a procedure that I've performed countless times, this time round it's a little different because she doesn't really have a normal eye. I don't know what I'm going to find, so be very careful. I'm just at the point where I can visualise the full eyeball, and at the back is the optic nerve. And one of the major complications of this surgery is A, cutting the nerve and the big blood vessel that's there and hoping that it doesn't bleed excessively. But also, you can accidentally damage the cat's vision full stop. It can actually pull on the optic nerve on the other side. So it is definitely a point where, well, A, it's no going back, and B, you just hope you do a good job because the cat can wake up blind on the other side.
I'll be quite pleased to see her. I'm a bit sort of on the edge of my seat.
Right, so this is the point of no return now. Just about to cut the optic nerve. So that's the eye and all the support tissues around the outside. By removing them all, we've now got a nice clean slate. We don't have any problems there now, and I can close it up, and hopefully we'll have a happier and more attractive Josephina. But right now, it's not attractive. Hey.
How are we doing? Oh, wow.
Yeah, not
How's the
bad.
girl getting on?
Yeah, she's nearly done. I think you'd relate to this cat.
Why?
Just because, you know, she's really kind of shy and just gentle.
Oh, is she?
Not bossy at all. No.
That sounds exactly like me, Scott. She's not a quiet, shy cat in the slightest, is she?
Nathan was wrong.
Yeah.
In all fairness, I never leave a mark. That's all I'm saying.
It's all emotional scarring, not physical. Okay. Done. Here she is.
Oh.
Here's your
I
girl.
can hear you. Wow, look at you.
So that's the new face of Josephina.
Oh, that's all going to be fine in just a few days' time.
Yeah.
What a brave girl.
I wonder if her kingdom's gone amok since she's been away.
I know.
All those other cats, I bet they've been sitting in your chair. Hey?
I expect the cats at home will see her arrive back and think, oh, she's back again, where's she been? So I'll just say she's been to London to see the Queen or something like that. But they'll all be pleased to see her, I'm sure. And were you a good girl? I bet you were, weren't you?
Sort of.
Sort of. We've got a lovely little bed for you when you get home. What a brave little soldier. And obviously her eye looks a bit messy, but it's going to be fine once the stitches all dissolve and the fur starts to grow. She'll look as pretty as ever.
There you go.
Thank you.
All right then.
Thank you very much.
See you later, Liz. Take
Okay,
care.
bye-bye.
Bye. Bye, Josephina.
Come on, puppets. Good girls. Brave girl, brave girl. Josephina, come on. Uncle Scott will be here in a minute. Come on, let me see you.
In Sussex, Scott is back at Liz's cat sanctuary to see how Josephina is recovering from her eye operation.
Hello, Liz.
Hi.
How are you? Mwah. Great to see you.
I know.
Hello, pussycats. I'm really looking for the lady of the hour.
Yes.
Where is she?
She's actually in her solarium.
Wow.
And she doesn't seem to want to come out.
She's taken that whole princess mantle to another level. Hasn't she?
Yeah, she has.
Yeah. So tell me, how's she been since the procedure?
Really happy. I mean, she really is.
Yeah.
And she hasn't got that sort of slightly pained look that she'd sometimes have.
So no wincing, just a lot of winking now.
Yes, lots of winking.
Yeah. Yeah, well, let's have a quick
really
look
good.
at her. Hey, can I have a quick look at you, sweet pea? Hey.
Josephina!
Hey.
Josephina is just like a little powerhouse. I mean, she's like as if she's recharged all her batteries. It's like she's kind of gained extra confidence or something, and she's so full of herself. She really is, yeah. She looks very comfortable and not in any pain at all.
Well, I mean, that looks great, doesn't it?
Yes.
So nice and flat against her face.
It's a really nice shape, actually.
Yeah, well, that's really what I was going
very
for.
Natural.
And once that hair grows back,
gosh, yes.
I think you just won't notice.
I don't think so either.
Hey?
Oops. Oh, she's had
she wants to
enough
go
now.
straight back to the solarium. Do you? Hey? Oh, I'm terribly sorry. The surgeon gets out the building because I need my spa treatment to return. Hey? It always amazes me that Liz finds a little piece of her heart for every single cat that she looks after. But Josephina, I think, has a slightly bigger piece than most. Liz seems very happy that Josephina's made such a great recovery. She's the happy princess that she will always be. So hopefully she keeps her queen bee status.
Yes,
even
princess.
with only one eye.
Yeah.
I think she'll do it, don't you?
Yes, definitely.